If a patient is not adequately ventilating on his or her own, which may mean the patient is not breathing at all or the patient is breathing but not exchanging adequate amounts of air, it is necessary for the EMT to support ventilations mechanically. For the EMT, the tool of choice to ventilate a patient is a bag valve mask. The device consists of a face mask, a one-way valve, and a bag. Many bag valve masks will also incorporate an oxygen reservoir as well. When utilizing a bag valve mask, the EMT should always utilize manual airway techniques, airway adjuncts, and supplemental oxygen to deliver high concentrations of oxygen to the patient while ensuring a patent airway. Do not hesitate to suction the airway if necessary. Also remember to take appropriate cervical spine stabilization precautions if warranted. Assembly of the bag valve mask is relatively simple. Begin by expanding the bag itself. Attach the oxygen reservoir bag, if included, and the face mask. Attach the oxygen tubing to the bag valve mask and connect the other end to the regulator on an oxygen cylinder or to a regulator within the ambulance. Ensure the oxygen supply is on and set the regulator at a high flow rate, typically 15 liters per minute. If the EMT is functioning alone, he or she should use the EC technique for establishing a face mask seal over the patient's face. Grasp the face mask using the palm, thumb, and index finger to form a C over the face mask. Place the face mask over the patient's nose and mouth. Utilize the remaining fingers under the patient's jaw to form an E and anchor the hand to the face. Squeeze the bag with the other hand, delivering enough air to produce visible chest rise in the patient. Release the bag and allow it to refill with air. Squeeze again and repeat as necessary at an appropriate rate determined by AHA standards or local protocol. If at any time chest rise does not occur when the bag is squeezed, reassess the equipment, technique, and patient. In some instances, the rescuer failed to maintain an adequate seal between the face mask and the patient's face. In other instances, the patient's airway may be occluded given a foreign body or improper positioning. When available, a second rescuer should be utilized to assist in bag valve mask ventilations. The second rescuer can utilize the EC technique with two hands to ensure a face mask seal over the patient's face, while the primary rescuer can use two hands to squeeze the bag.